you're pregnant, you're in pain, maybe you have fever and your doctor told you to take acetaminophen, but you've heard all this conflicting noise about acetaminophen and possibly autism and ADHD, and you just don't know what to do. We're going to talk about that today. I'm Dr. Sidhu. I am a family practice and a lifestyle medicine doctor. I'm also the founder of Spring Monarch Primary Care, a direct care practice here in Houston. I approach medicine in a holistic view with evidence-based medicine. I love to explain things to patients in a way that they can understand so that they can make informed decisions and then create customized treatment plans for each individual patient. One size does not fit all when it comes to health, and it's really important that we understand the nuances of each individual patient and each individual treatment plan. So today, I'm going to break down this controversy between acetaminophen and autism and what it really means. I'm going to explain to you, I'm going to help make sense of the controversy. I'm going to explain to you why it's important that we have something for pregnant women to take when they have pain or fever. And then I'm going to tell you if or how it has changed my personal medical practice. Let's dig in. So first of all, if you take one thing from this video, I want you to understand how important it is that we have something to use when a pregnant woman has fever or severe pain. Let's start with fever. When a mom has fever, it heats up the womb. When we heat up the womb, it causes stress for the baby. It can cause heart defects, it can cause neurodevelopmental problems, and it can cause preterm labor. So when a woman has a fever defined above 100.4 or more, we need to treat the fever, and we need to have something safe to treat the fever. The only other alternative over the counter right now is ibuprofen, and that is absolutely not safe for pregnant women, especially in the third trimester. It can be harmful for the baby and the mom. So acetaminophen is sort of what we have right now, but we cannot just leave fever and we cannot just let it be. The second thing is when a pregnant woman has severe pain, we can't just let women suffer through severe pain. Number one, severe pain limits mobility, and then we risk blood clots and sugar going up and blood pressure going up and all the things. Also, sometimes women in pregnancy have to have procedures or surgeries, and we can't just let them, just push through that post-surgical, post-procedure pain. We have to address the symptoms that are causing the most stress on the mind and the body of the mom. So that is why it is important that we have some options when it comes to fever and pain in pregnancy. So now let's talk about the controversy, okay? So when I'm referring to these today, I'm going to refer to one, the Harvard study as it's being referred to now, which is the most recent study that is being talked about in the administration. And then I'm also going to talk about the Sweden study, which was a large study that looked at siblings, over 2 million kids. And I'm going to compare the two and tell you, what the pros and cons are of each study. All right, let's talk about the Harvard study first. And I have put more details about each of the studies in the captions so you can know more about what I'm talking about. So the Harvard study had some really key scientific issues. In fact, if I were to take this article to Journal Club in medical school, my attending would have pushed it away because it did not meet minimum criteria for strong scientific evidence. And here is why. Number one, the studies that it compared did not compare the same types of information in each study. All the studies were very different, and so you can't create a commonality between them. Number two, it was not a new study. It was a review of old studies, and it's not new information. Number three, there was a major conflict of interest because one of the main authors had previously been a paid witness expert in a lawsuit against Tylenol and had been paid quite a bit of money. Just a couple of years ago, the judge apparently threw that case out, saying that the data had been cherry-picked. And so for those three reasons, this study comes into question for scientists and health experts everywhere. On the other hand, we do have another study to look at, and we have what we call the Sweden study. Now, the Sweden study looked at siblings, and I'm going to give you an ice cream analogy here to help make sense of the difference in the two studies. Let's talk about ice cream and sunburn. If we were to look at families who ate more ice cream and said ice cream leads to more sunburns, that is what the Harvard study was basically doing. Meanwhile, if we looked at each individual family, same genetics, same backyard, pretty much same type of ice cream, same everything, and we saw that, yes, the kids who are eating more ice cream are getting more sunburns, then we could say that the ice cream was causing the sunburns, because we have eliminated the variables like genetics, environment, time of year and all of that. So the Sweden study was more like random, putting it down to each individual family, versus the Harvard study was like an overview of anyone who eats ice cream in any family. So I hope that helps you understand the difference between the two studies. The thing is that the sibling studies really helps cut out the noise. It helps cut out those extra factors. Like, we know that fever is stressful on babies. So women who take acetaminophen because they have a fever, was it the fever that caused the neurodevelopmental problems, or was it the acetaminophen? And so the Sweden study takes account for that, whereas the Harvard study doesn't necessarily do that. All right, now I am going to I don't want to make it sound like acetaminophen has no problems. It is a medicine that has problems. Number one, we know that it can cause liver damage in pregnant women and non-pregnant women. We know that it reduces glutathione, which is important for oxidation. And we know that it has a lot of problems that make it hard to take. Not everybody can take it, but it is still the safer medication for pregnant women in terms of if you compare it to ibuprofen and acetaminophen. Now, of course, prevention is best, right? We don't want our pregnant women to have fever. We don't want our pregnant women to be in severe pain. And so if we can do anything to prevent them from needing the medication, that is excellent. Things like continuing to be active during pregnancy. Stretching is super helpful for women for back pain. Making sure that you're staying away from sick people, washing your hands a lot, getting, the shots that your doctor is recommending at certain times of the season and pregnancy, making sure you're getting enough sleep, making sure you're eating enough plants, making sure you're minimizing stress. These are all super important in keeping your immune system up. But what do we do when a woman still gets fever and still has severe pain? So I read the Harvard study and I really drilled down. And the thing is that for most of us doctors, it's not that we never ask the question, does acetaminophen cause autism? The question has been asked many times, hence the studies. But this new release, this new review, did not show us anything that we didn't already know. And in fact, the data that it did show was questionable. So prior to this controversy, prior to this week, I was telling my patients, if you have a fever of 100.4 or higher, you have to take Tylenol to reduce the fever. Otherwise, we run into risks for the baby. Okay. If you have severe pain that is not manageable by stretching, by walking, by resting, then you need to take something so you can get up and moving and do the things you need to do. If you have a procedure or surgery, I don't want to be cruel and just limit all types of pain medicine. That is really stressful on the body. I have always told patients the shortest, most effective dose for the shortest amount of time. That's just been the way I've practiced from the beginning. And this week, after these studies, the truth is that has not changed. I'm still going to tell patients the shortest, most effective dose. And the interesting thing is this Harvard study that people are talking about, the author actually said essentially the same thing. While he did say they did feel like increased risk was seen with the acetaminophen use, he still said we have nothing else out there that's better for pregnant women, and fever is a problem in pregnancy, and physicians should use acetaminophen judiciously, which is what me and my colleagues generally tend to do. Now, I will tell patients, because we know that it impacts glutathione, because we know that we don't want you to take a lot of it, do other things that can help support your immune system even while you're on it. Eat eat a healthier diet. Make sure you get enough sleep so you recover quickly. Make sure if you have a bacterial infection, you take the right antibiotics. Make sure that you are getting sunlight to increase your immune system. So there are things that we can do to support the body while you are on a medication to lessen the side effects. All right, I know that was a lot of information. I do hope that it was helpful. When you're pregnant, it is just a tough time as it is, and it is tough, to be in the position where you need to take care of your baby and you need to take care of your body, and you just don't know how to do it, and everything feels so confusing. So I do really hope that this was really helpful. If you want to work with me, I have linked a link that you can schedule a free 15-minute virtual meet and greet with me. So for those that are living in Texas and want to be a patient, please reach out. If you liked this, if this video is super helpful, please like it. If you want to see more content like this, please subscribe so you don't miss anything. Please share with a friend who needs this, and I will see you in the next one.